So guys, look at this question here. They are asking about the anticoagulants. Name newer anticoagulants. Okay, for 3 marks they are asking. What are they asking about? Anticoagulants. That means these won't let the blood clot. Coagulants. And are they asking about all anticoagulants? No. Very specifically, they are asking newer anticoagulants. The new ones only they want. Okay. Old ones, what were there? Do you know? Okay. So look at the classification here. Then you will be able to understand old and new. Old, what did you have? Heparin, low molecular weight heparin. Fondaparinux. So all these were parenteral. When it comes to oral, very famous, you have warfarin, right? So these are all the old ones. New ones, what they have asked in this exam, right? So you have to name the new ones. New ones we will call it as DOCA. No, DOACs, direct oral anticoagulants. Okay, DOACs. These are the new ones. Okay, DOACs. Now in DOACs, what and all will come? You know, this is what they have asked in the exam. Rivaroxaban, Apixaban, Edoxaban, Dabigatran. This only you have to write in the exam. So which are the newer oral anticoagulants? They didn't say oral, they said anticoagulants. So those are the newer anticoagulants are these DOACs, that is direct oral anticoagulants. In that you have two types. You have the direct factor 10A inhibitors, and then you have the oral direct thrombin inhibitor. Under direct factor 10A inhibitors, you have three names that you have to write. That is Rivaroxaban, Apixaban, Edoxaban. Under oral direct thrombin inhibitor, DTI, under oral, it's oral only, direct thrombin inhibitor, you have Dabigatran. So will you be able to write them in the exam? DOACs, direct oral anticoagulants, in which you have the factor 10A inhibitor. Okay, in that you have three names to write. Rivaroxaban, oh god, what were those names? Rivaroxaban, Apixaban, Edoxaban, and under DTI you have the Dabigatran. Okay, that is direct thrombin inhibitor. Okay, so all these are tablets only. You can see here, all these are oral, right? So you can remember the dose if you can. Okay, Rivaroxaban 15 mg, Apixaban 10 mg, then they'll make it 5, then Edoxaban 60, then 30, you will go on reducing. Dabigatran 150 mg. Okay. See, the main points we will tell you what is good about this and what is bad about this. Okay. What is bad, first you see, is it is contraindicated if the creatinine clearance is less. Okay. Because if have to be removed by the kidney. So you have to be very careful that if kidney functions are less, if creatinine clearance is less, there's some value cutoff and all that you can look at. Contraindicated. Okay. So what do these do? These are anticoagulants. They won't let the blood clot, right? So you want good blood flow, right? You don't want the blood to clot. Like you want to prevent a stroke in a person who has atrial fibrillation. That guy can go into clot, right? Then after an orthopedic surgery following a total hip replacement, total knee replacement, if there is an acute DVT, thrombosis, deep vein thrombosis, if there is a pulmonary embolism, and there is a things to understand here. It's not as simple as you give it in all DVT cases or something. Okay, and if there is venous thromboembolic disease, VTE, something they're saying, that time also they're talking about this oral anticoagulants. Okay, direct acting oral anticoagulant we're talking about here. Okay. So what is so great about these newer anticoagulants? They have predictable dose effect. They do not require lab monitoring. Like when you give the others, you will have to monitor the bleeding, coagulation and all that. But here you don't have to do any monitoring, they are saying. Okay, but it is not as simple as this. Some monitoring will be there. Okay. Independent of vitamin K. These are independent of vitamin K. That's what they are saying. So nothing to do with diet. These are renally metabolized. So we told you kidney function should be good. Okay. If it is reduced kidney function, you should not give. So main thing you focus, guys, that monitoring that you do when you give other anticoagulants may not be required here. Okay. Then they are saying that these are immediately active, which is also good for us, right? Immediately it will act. You don't have to come, the word that overlap. You don't have to overlap with some other agents, etc. because these will act immediately, they are saying. Okay. So they are saying that they have lower bleeding risk than warfarin and this low molecular weight heparin. These are recommended as first line for VTE. but you should always make sure that the kidney is working properly. Okay. So lower bleeding risk, this one you highlight. Okay. Then you say that it acts immediately, no need to overlap with others. Then no need to monitor. This is what they are saying. Like INR, prothrombin time, all this no need to monitor, and it is independent of vitamin K. Let's make this also green. So what are the points you will say? It is predictable, no need to monitor too much of lab things, independent of vitamin K. Then what else? Immediate action, lower bleeding risk. This much you will write. Okay. Next, let's move on to some extra points that you may want to know. If you give this and there's bleeding, then how will you reverse it? Okay, that reversal agent for all DOCAs, what you will do, if you will administer activated charcoal, okay, and not always that you need that they are saying, but what are the specific agents? Let's look at specific agents for reversal. For Dabigatran, it's idarucizumab, okay. Idarucizumab is for Dabigatran, and for Rivaroxaban, Apixaban, Edoxaban, there is one name that they have given here, Andexanet actually, Andexanet, okay, or any prothrombin complex concentrate, activated prothrombin complex they are saying, okay. So have you understood DOACs? DOACs is direct oral anticoagulants. If they give DOACs in the exam, you write. If they give you anything about newer anticoagulants also, you will write this, okay. This, do you remember this coagulation cascade, intrinsic pathway, extrinsic pathway, okay. So the common pathway has this factor 10, guys. So that is what was trying to inhibit. That Rivaroxaban and all, it is trying to inhibit factor 10 so that the clotting doesn't happen. What about that direct thrombin inhibitor? Where does that sit here in this coagulation cascade? See here, direct thrombin inhibitor. So conversion of prothrombin to thrombin, this is almost the last stage, right? Somewhere here I'm thinking that inhibition will happen, direct thrombin inhibition. You need to keep this entire thing in your brain, guys. Okay. So this is what I told you, 10A, direct factor 10A inhibition and direct thrombin inhibition. Okay. Rivaroxaban, Apixaban, Edoxaban, Dabigatran. Bye bye.